the hidden clues doctors see in you. Imagine walking into your doctor's office, thinking everything's fine, only for them to spot something alarming in seconds. Did you know that doctors can instantly detect serious health problems just by glancing at certain hygiene slip-ups in older folks? These everyday habits you might shrug off as no big deal could be screaming red flags about deadly issues brewing inside you right now. What's downright terrifying? Most seniors don't even realize they're making these life-threatening mistakes every single day. In the next few minutes, I'm going to pull back the curtain on 7 shocking personal hygiene blunders that doctors notice immediately in their elderly patients. And here's the kicker: fixing them could literally be the difference between life and death for you or someone you care about. This isn't stuff you learned in school. It's rarely whispered about in doctors' offices, and you won't find it splashed across health magazines. Yet, it could mean thriving in your golden years, or losing your independence to preventable conditions that strip away your dignity. Let me tell you about Harold, a 75-year-old retired engineer who thought he had his routine down pat. He was the guy everyone admired, active in his neighborhood, hitting the golf course twice a week, and never missing his grandkids' baseball games. During what he figured was a standard checkup, his doctor's eyes narrowed. In moments, he pinpointed 3 glaring hygiene errors that screamed Harold had a dangerous condition, simmering for months, completely unnoticed. "I was clueless," Harold confessed to me later. "I thought I was doing everything right. If my doctor hadn't caught those tiny slip-ups, I might not be here today." Curious yet? Stick around. I'll spill exactly what those mistakes were and how you can dodge Harold's scare. Better yet, I'll show you simple tweaks that could add years to your life. Starting today. Mistake 1. Ignoring your mouth a heart attack. Waiting to happen? The silent threat in your smile. When's the last time you really checked your toothbrush? Is it a frayed mess? Are you brushing twice a day like your life depends on it? Here's a question to make you squirm. Did you know that sloppy dental care isn't just about stinky breath or missing teeth? It's a straight path to heart disease, strokes, and even dementia? That's right, your mouth could be a ticking time bomb. Harvard Medical School's geriatric experts have hard proof: bacteria from neglected gums don't stay put. They sneak into your bloodstream, sparking life-threatening heart conditions. Their studies show seniors with lousy oral hygiene are 3 times more likely to face cardiovascular disasters than those who keep their teeth in check. 3 times! That's not a typo, that's a wake-up call. Sylvia's wake-up call. Take Sylvia, a 68-year-old retired teacher from Oregon. She brushed off her bleeding gums for months, thinking, that's just what happens when you're my age. She told me, I figured it was normal, no big deal. But at a routine checkup, her cardiologist spotted trouble: inflammation in her heart valves, directly tied to oral bacteria that had hitchhiked through her blood. The doctor's warning? A few more months and it could have been too late. Sylvia's lucky she dodged that bullet, but will you? What to do today? Here's your action plan. Grab your toothbrush and inspect it. If it's over 3 months old or looks like it's been through a war, toss it now. Better yet, switch to an electric one. Studies from the University of Pennsylvania. Dental schools say they zap 62%. More plaque than manual brushes. Brush for a full 2 minutes twice a day. Set a timer if you're lazy. Floss every night, no excuses, and don't skip your dentist. Even if you've got dentures. Notice bleeding gums or swelling? That's not just aging, it's your body begging for help. Are you brave enough to face the mirror and act? Mistake 2. Skimping on bathing. What's your skin hiding? Your largest organ is talking. How often do you shower? Be real with me, once a week? Twice? A lot of folks slow down on bathing as they age. But here's the shocker. Your skin, your body's biggest organ, could be waving a giant red flag about internal chaos. Skip too many showers, and you might miss early warnings of diabetes, liver trouble, or heart issues. Dermatologists at the Mayo Clinic aren't joking around. They've found that cutting back on bathing hides critical clues. Their research says nearly 40% of undiagnosed conditions in older patients could have been caught sooner with better skincare. Your skin's not just there to look pretty. It's a billboard for what's going on inside. Clarence's costly oversight. Consider Clarence, a 77-year-old retired postal worker from Michigan. He figured once-a-week baths were plenty, especially in winter when his skin got dry. "I didn't want to make it worse," he explained. But during a visit for something unrelated, his doctor noticed odd skin discoloration. Tests revealed early kidney disease, masked because Clarence's rare showers hid the signs. A few weeks earlier, and he could have caught it in time. Are you rolling the dice with your own skin? Your bathing game plan. Set a schedule, bathe at least 3 times a week, even if you're not breaking a sweat. Use a gentle, fragrance-free soap to keep your skin's natural oils happy. After your shower, slap on moisturizer while your skin's still damp to seal in the goodness. Most crucially, check your skin often. Any dry patches, weird colors, or itchy spots? That's not old age, it's your body sounding the alarm. Will you listen or keep pretending it's no big deal? Mistake 3. Neglecting your nails. What are they telling you? Your nails don't lie. Pause right now. Look at your fingernails and toenails. Are they trimmed, clean, free of funky colors? Your nails are like a health report card, and doctors peek at them first for a reason. The American Academy of Dermatology says nail changes can signal over 20 serious conditions. Think anemia, thyroid problems, or heart disease. Their data's chilling. In folks over 65, nearly 30% of hidden health issues were uncovered because of nail oddities. That's not a small number, it's a massive clue your body's dropping. Beatrice's nail nightmare. Meet Beatrice, an 82-year-old who didn't sweat her thickening, yellowing toenails. Just part of getting old, she told me, hiding them in closed shoes. But when foot pain forced her to a podiatrist, the truth hit hard. A fungal infection had raged, so long it exposed a weakened immune system. Further tests uncovered a major condition needing urgent care. "I thought it was nothing," she said. Don't let your nails fool you too. Nail care. Trim your nails regularly, straight across, with slightly rounded edges to avoid ingrown trouble. Keep them clean and dry, wear breathable shoes, and swap socks daily. Notice brittleness, discoloration, or thickness. That's not vanity, it's your body shouting for attention. Are you ready to stop ignoring those signals? Mistake 4. Mishandling incontinence. Are you too ashamed to act? The taboo no one talks about. Here's a bombshell. Over half of seniors deal with some form of incontinence. But the real shock? Most hide it instead of fixing it. Are you one of them? This isn't just embarrassing, it's dangerous. Urologists at Johns Hopkins Medicine warn that untreated incontinence sparks skin infections, falls, isolation, and even hides killers like bladder or prostate cancer. Their stats? Seniors who tackle incontinence properly face 60% fewer complications than those who cover it up. Hiding it doesn't make it go away, it makes it worse. Douglas's prideful mistake. Douglas, a 73-year-old retired accountant from Arizona, was too mortified to tell his doctor about his leaks. He stuffed paper towels in his pants and swapped clothes often, thinking he had it under control. When painful sores forced him to seek help, doctors found an advanced prostate issue, missed for months because of his silence. "My pride almost killed me," he admitted. "I should have spoken up sooner." Will your pride cost you too? Take charge now. Never be shy. Talk to your doctor about bladder troubles. They hear it daily. Ditch makeshift fixes for real absorbent products designed for incontinence. Change them fast when wet and clean properly to avoid skin damage. Most importantly, know this. Leaks aren't normal aging. They're a sign something's off. Are you ready to face it head on? Mistake 5. Ear cleaning gone wrong. Are you deaf to the danger? The cotton swab trap. What's your ear routine? Be honest, do you jam cotton swabs deep inside? If so, you're flirting with disaster, just like tons of seniors. Wrong ear care doesn't just mess with your hearing. It hides infections that could turn deadly. Otolaryngologists say improper ear cleaning causes nearly 40% of ear canal injuries in folks over 65, often leading to avoidable infections. Are you risking your ears without even knowing? Patricia's painful lesson. Patricia, a 71-year-old retired librarian from Washington, used cotton swabs religiously until she punctured her eardrum. The infection spread fast, and she lost some hearing permanently. "I always cleaned them that way," she said. No one told me it was risky. Don't let her story be yours. Ear care done right. Here's the golden rule. Nothing smaller than your elbow goes in your ear canal. Wipe the outer ear with a warm, damp cloth. For wax buildup, use doctor-approved eardrops. Follow the instructions to a T-pain, discharge, or hearing shifts. See a pro ASAP. Are your ears itchy or blocked? Don't play hero, get help! Mistake 6. Foot neglect. What are your feet screaming? Your feet are talking. When's the last time you really studied your feet? Not a quick peek, but a deep dive between the toes. Heels and soles? Your feet are a goldmine of health clues, and doctors check them first for a reason. The American Podiatric Medical Association says foot hygiene. Slip-ups often flag diabetes, neuropathy, or vascular disease early. Their jaw-dropping stat? In folks over 65, proper foot care could prevent 85% of diabetes-related amputations. Yes, 85%, that's life-changing. Raymond's close call. Raymond, a 76-year-old retired factory worker from Illinois, ignored his dry, cracked feet and tiny cuts. They've been rough forever, he told me. But at a routine exam, his doctor spotted trouble. Diabetes caught early thanks to those feet. If he hadn't looked, I'd be in bad shape, Raymond said. Are your feet begging for attention? Step up your foot game. Wash and dry your feet daily, especially between the toes where fungus thrives. Check them often for cuts, sores, or color changes. Wear clean, breathable socks. Moisturize dry spots, not between toes, and never ignore pain or numbness. Notice cracks or slow-healing wounds? That's not just feet, it's a call for help. Mistake 7. Medication mess-ups. Is your medicine betraying you? The side effects you can't smell. Taking multiple meds? Noticed weird body odor, extra sweat, or a dry mouth since starting them? Those life-saving pills might be brewing hygiene troubles that signal danger. The American Geriatric Society says common drugs can trigger dry mouth, sweating, or odor shifts, early hints of toxicity. Their research? Nearly 40% of bad drug reactions in seniors show up first as hygiene changes. Are your meds hiding a secret? Barbara's smelly surprise. Barbara, a 67-year-old retired nurse from Florida, couldn't figure out her odd body odor. Her family blamed poor hygiene, but her doctor knew better. It was medication toxicity hurting her liver. I showered daily, she said. I didn't know it was from inside. Are you missing the signs? Protect yourself. Track changes after new meds. Jot down notes about odor, sweat, or dryness. Stay hydrated unless your doctor says otherwise. Report weird smells or sweating to your doc fast. It could be a drug clash. Never tweak doses on your own. Notice odd odors or dry mouth? Don't chalk it up to age, act now. Wrap up, your life's on the line, act now. Now you've got the scoop. 7 hygiene mistakes doctors spot in a heartbeat, and how to fix them fast. These aren't just about looking good, they're your shield against serious health crashes. Start today, and you could save your independence, your dignity, and even your life. Loved this? Smash that like button! Has your doctor ever flagged these issues? Drop your story in the comments. Subscribe and hit the bell for more life-saving tips. And share this with anyone over 60. It could be their lifeline.